Welcome back to Open BXRx. Our seniors always need extra care and protection. Their caregivers are there to support. COVID-19 has only magnified this need. And mental health does not discriminate against age. Isolation has been a cause for concern in our communities. And Dr. Anderson Torres is the CEO of Rain Total Care, and he's also a mental health professional. He's here to speak to us about these important topics. Thank you for joining us, Dr. Torres.
No, thank you, Ms. Lopez, for the opportunity. I'm really glad to be here. And if I could be of any assistance to anyone who's listening, that's what we're, all about.
Thank you so much. The first thing we wanted to start to talk about, Dr. Torres, was about the additional challenges seniors and caregivers are facing during this time due to COVID. Can you talk a little bit about that?
Oh, absolutely. I think that I need to briefly refer to the organization that was founded in 1964. So we've been around for a very long time. And between all of the different products and programs that we offer, we serve about 4,000 individuals. The majority of those are the elderly. New York City Department for the Aging defines an elderly person as anyone who is 60 and above. So we have 13 senior centers. And within that, the age range is from 60 to 104. There was one individual whose birthday was today, and we were going to have a big celebration at one of the senior centers. Her name is Mother Turner, and we were going to celebrate her big milestone. But unfortunately, because of what we're going through, we had to cancel and restructure the way we do business. Thanks to the New York City Department for the Aging and the other funding sources that we have, we've been able to provide some support to the senior population. We went from having a senior center where people came and played pool, did yoga, tai chi, dancing, Zumba, and meals and birthday celebrations, to just having to come in, grab a meal, and go. Now, the New York City Department for the Aging, through its connections and resources, has redefined that. And as we speak, the food is being delivered to the person's home so that they don't have to come out to the senior center. Unfortunately, I must tell you that, especially in the Bronx, the Bronx was the worst in their score for health outcomes out of all the counties in New York State. We were the last. And being a borough that's very mixed with different cultures, the predominant culture is Hispanic Latino, there are a lot of comorbidities with the people that we serve. So it's not unusual, and I'm sure that you can relate to this, for someone that we know who may have diabetes, hypertension, cardiac disease, arthritis, chronic obstructive pulmonary disease, and a host of and obesity and a host of other conditions. It puts our seniors in particular at such a high risk that it's scary. I'm very sad to report that we have already lost seniors to COVID through the different senior centers. And some are also in critical condition as we speak in some of our hospitals here in the Bronx. Now, on the home care side, we serve all ages, children and adults, but the majority of the people are seniors. And I tell you that we've already lost 15 patients to COVID-19.
Wow.
Elderly. And the home health aides are also at risk. And this is just the pandemic has really impacted all communities, all families, all over the world.
And Dr. Torres, Rain continues to provide those resources and services remotely. What are some of those services that seniors and caregivers can receive at this time?
Oh my gosh. Well, let me tell you something. I'm very proud of my staff, I must say, who have been there to meet a need. We have been able to, through our 20 programs within the organization, we have another program where many people will know it as Meals on Wheels. It's called Rain Senior Options. And I have drivers and meal deliverers that go and actually deliver a meal to a homebound elderly individual. That has not stopped. Actually, we've been getting calls from seniors, from caregivers. Listen, my parent needs a meal. Can you assist? Or they're senior themselves. I can't get out. I don't have any food. Can you please come over and give us a meal? And we've been able to provide that. And if it's not in our catchment area, through our network, we also then link up with other sister agencies to coordinate the delivery of that meal. Now, we have that, and then we have also the Cucina Dolores program, which is funded by the Bob and Dolores Hope Foundation. The comedian that we knew, Bob Hope, his wife was raised in the South Bronx, and my founder, Beatriz Casigla Catulo, had met folks from the foundation, and they wanted to identify a community-based grassroots organization like ours, and we've been partnering. That Cucina Dolores truck is a mobile food truck. And to this day, we're going to different neighborhoods in the Bronx, and we're providing a hot meal that is ready to eat. And with this, we've been able to go to places of worship. There's some churches that we're passing by, to shelters, to encampments, to certain street corners, and providing that meal because people are going hungry. And they're going to the grocery stores or the supermarkets, and they're not finding items. For some of us, it may be very difficult to even find like chicken in a supermarket. So that truck is God sent. And I must tell you that I received a call from a community provider in the South Bronx that has over 2,000 seniors in their housing complex that have not had access to food. And so through the Cucina Dolores program, we were able to add them to our route and provide the nutritionist meal. Wow. And for the caregivers that are isolated, we have an Alzheimer's Caregiver Link program, and we've been able to engage in remote support group and advocacy for that client population. So we've been able to still render services, although from the office, the staff is predominantly working remote, but then we have the field staff that are out there every day in the trenches, diciendo presente, to try and meet that need.
Wow. Dr. Torres, social isolation has always been kind of a worrisome topic for both caregivers and seniors. And now with COVID, it seems to have heightened these worries. How could the youth support or this generation support our parents and grandparents during this time of social isolation, worry, and quarantine?
You know, we have several partnerships going on within the organization. And I'm very proud to say with Lehman School of Social Work, Silverman School of Social Work at Hunter College and Fordham University, and we have social work interns that have been a part of our FODE. Through the progression of the coronavirus, COVID-19, some of those programs have begun to stop. But we continue with our social work interns from Lehman. They have been able to make phone calls to the homebound client that's isolated to check up on them. We also have a program called the Telephone Reassurance Program, Friendly Visiting Program, and we're able to also make those calls. So that way, the individual at home doesn't need to feel threatened or afraid that someone is coming into their home and possibly infecting them. But they have stated, thank you for the call. This is the only call that we've gotten today. And that does wonders to individuals' mind, body, and spirit, to be able to connect with another human being. So through Range Services, we're able to provide that level of support. And there's nothing better than to hear another friendly voice over the phone.
I love that. A simple phone call nowadays will really make the difference when it comes to seniors and those who are socially isolated. And speaking of, I mean, how can we support RAIN at this time before we go on to the next topic, Dr. Torres?
Sure. I think it'll be important to visit our website, www.raininc.org. And, you know, whether it is a donation that you would like to make or find out more about a program or a service, and giving us a call and seeing how we may be able to utilize your level of expertise, you know, being able to volunteer even on the meal delivery route, please give us a call and we'll find a way to connect.
And I'm glad that we have you here because you're also a mental health professional. So I just wanted to get into the fact that mental health today is more important than ever. I mean, it's always been important, but isolation has been affecting many mentally. What would you say about that, about the effects of COVID-19 on the mental psyche?
Well, that's thank you. That's an excellent question, and I'm glad that you are asking it. Many people need to really engage in a conversation regarding mental fitness, mental health, an emotional tune-up, and don't see it as anything negative. COVID-19, and I've seen it in practice already, where it can bring about symptoms related to panic attacks,
Mhm.
anxiety, depression, post traumatic stress disorder. And if there are already underlying um, psychological distress or worries, it will magnify that to a degree where the individual may feel a certain degree of hopelessness, and that's not easy to deal with. Uh, we've been able to identify the fear. I've been hearing a lot of people stating, there's a pressure on my chest. Do I have COVID? When they're not symptomatic or have been exposed and they've been cleared, but it's that level of stress, la pendencia, la preocupación,
I
for
see.
those of us that are, of Spanish background and can relate to that. And it's very important to take a chill pill, so to say, not an actual pill. This is just a metaphor, and be able to reflect and take a step back, take a deep breath, right? And also being able to think of a very happy memory, something that you're looking forward to. The fact that we're not in a hospital right now, the fact that we're managing as independently as we are, to be able to connect with others. There's also professional isolation. And in speaking with individuals in the field of health, with social workers, with doctors, with nurses, they have told me it's a war zone. When we go to work, when we hear code, code, code repeatedly, it gives them a sense of powerlessness, where they can't do anything and they're losing a certain level of control. And that's where it's very important to, take an emotional break and meditate, engage in a certain breathing exercise, reframing the mind so that you get a break from the actual situation. As we know, unfortunately, hospitals are seeing a large number of deaths of people dying as a result of COVID-19. And that also has a certain element of not only stress, but maybe guilt in what else could I have done?
Right.
Where did I fail? How am I going to tell a family member who may not be allowed into the room or into the hospital that their loved one hasn't made it? So that constant delivery of bad news, that has a toll. And we're human. And there's nothing wrong with admitting or reaching out to someone else saying, you know what, I need to talk to someone. Just hear me out. I don't want to be judged. Just, listen to me and have that outlet. And that's where it's important for us to be connected, one human being to another, to offer some level of support. You don't need, all the credentials on this planet in order to also be of support to someone who may be going through a very difficult moment right now.
Absolutely. Thank you so much for that, Dr. Torres. And thank you for joining us. And thank you to Rain Inc. for their continued support of caregivers and seniors during this time.
No, thank you.
Hmm.
Feel free to reach out. We're here. Listen, can you dodge a raindrop when it's raining?
No.
And that's who we are. We're a shower of services, okay? So remember that, whether it be a mental health need, whether it be a meal, whether it be a service, we're here all over. Una lluvia de bendiciones.
I mean, I had to think about it. I was like, can I? No, I don't think so. Thank you so much, Dr. Torres.
Right, thank you.
If you would like to stay in touch with RAIN Inc. and see how you can help our seniors and caregivers at this time, please visit raininc.org. That's all for our show today. Thank you for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Until next time.